Introduced in 1948 to subsidise the cost of prescription medications, the Pharmaceutical Benefit Scheme in Australia listed 906 different types of medications and 5,380 medication brands in June 2021. The most common medications dispensed by pharmacists are drugs used to prevent heart attacks and strokes. In 2020 alone, it's estimated that 11.2 million prescriptions for these life-saving medications were dispensed to Australians. As a disability support professional, it's likely the participants you support will require medication in a wide variety of forms. This can include tablets, capsules, wafers or melts, pastilles or lozenges, oral liquids, topical skin preparations, eye and ear drops, nasal drops or sprays, inhalants, transdermal patches, and subcutaneous injection of medication. It's important to note that this course will only cover oral medications stored in a dose administration aid, DAA. For more information about other forms of medications, for example, topical skin preparations, please refer to the NGO Training Centre's medication short courses. In Australia, medications can be classified into 3 different categories. These are 1. Prescription medication, 2. Non-prescription or over-the-counter medication, and 3. Complementary or herbal medication. Click on the buttons to see more. Let's now learn more about medications that may require additional controls to support public health and safety. Some medications carry a higher risk of harm if not used correctly. The Therapeutic Goods Administration, TGA, categorises medications and poisons into different schedules based on their use and the level of control required to promote their safe use in the community. Scheduling is a way of sorting out which medications or poisons need to be more tightly controlled and which don't. Let's find out more about medication schedule groups. Medications are categorized into different schedules based on their use and level of control. The schedules are Schedule 2, S2. These are medications only available at pharmacies. Schedule 3, S3. These are medications that are labelled as pharmacy-only medicine available over the counter at pharmacies. Schedule 4, S4. These are prescription-only medications that require a prescription from a healthcare professional, such as a doctor or dentist, and are available from pharmacies. Schedule 4 Declared, S4D. These are specific prescription-only medications that carry a risk of misuse, such as diazepam, also known as Valium, and clonazepam. Schedule 8, S8. These are prescription-only narcotic medications that can cause addiction or dependence and have strict controls, including storage in double-locked places and logging in a drug register. In most cases, only registered nurses can administer these medications. Disability support professionals can assist with medications from all schedules except S8, which has additional safety requirements. There are, however, some exceptions. Disability support professionals are only allowed to assist participants with 2 S8 medications that are included in the Poisons Regulations 2008. They are both commonly used for ADHD management and are called A. Dexamphetamine and B. Methylphenidate, also known as Ritalin. Any other S8 medication should be administered by a health practitioner like a registered nurse, the participant if they self-administer their medication, or their guardian. To assist participants effectively, you must understand your scope of practice and what must be referred to health professionals. Health professionals such as general practitioners, doctors, pharmacists, and registered nurses are qualified to provide advice regarding treatment and medications. Any questions or requests for advice about medications must be referred to the relevant health professional. Disability support professionals have a role in assisting participants with medication. However, this does not involve making any changes to medication or stopping medication. If you have any concerns about the medication a participant is taking, you must seek advice from the relevant health professional.